Hi, my name is Stevie and I'm going to be your fully trained dentist for today. Welcome to Chill Surgeries. Today I will be giving you a full dental examination. These dental examinations are nothing to be scared of. They're simply here to help me get a better grasp of your overall dental health as well as the state of your teeth. I promise to be as gentle and hopefully offer a relaxing experience today, because I know visiting the dentist can sometimes be quite nerve-wracking. So I promise to keep you at ease. Cool. So before we begin, can I just say, have our reception team taken down your contact details? They have. That's good. Sometimes they have a bit of a habit of forgetting to take down our patients' details. Obviously, these details are extremely important because we may need to contact you about the results of examination at a further date. Great. So I'm not going to keep you waiting for too much longer. I'm going to put on these gloves because we're all about hygiene here. Okay. And the other pair. Let's put these on. Like so. Okay. So before I take a look at your teeth, can I just ask you, have you had any issues or any problems with your teeth or your general dental health recently? Okay, so you've had a slight toothache just on the lower section of your teeth there. Okay, and how long have you had this toothache for? Okay, so a few days. Has it been painful or annoying for you? Okay, so not painful, but just slightly annoying, as I can fully understand. I really hate having toothache. It's one of those things that just sticks with you. It really does. I will have a bit more of an in-depth look at that section of your teeth just to be sure there's no cavities or any problems which we should be concerned about. I'm sure it'll be absolutely fine. Cool. So I'm on my own today. My colleague who usually takes the notes is sick for the 30th day in a row now, I think. It's been a bit of a struggle. I'm not a big note taker, to be honest, but I've got to take these notes because I'll forget else. So, slight toothache on lower crown. Okay. Okay, just write that down. Cool. Okay, so before I start having a look inside your mouth and at your teeth and your gums, I'm just going to have a quick look around your jaw area just to be sure there's no obvious signs of any issues or any problems which may need a more in-depth look at. So I'll be putting on this. We're all about hygiene here. If you could just stay still, I'm going to have a quick look just around your jaw. This won't hurt one bit. Am I allowed to touch your face? Is that okay? Great. I'll be gentle. Just stay still. Can you just tilt your head back a bit, just a tiny bit? That's it. Just have a quick look around your jaw. Like so. Just being extra careful. Just to be sure there's no obvious sign of any problem. Okay. Okay. Okay, perfect. Okay. Okay. Okay, perfect. Okay. Just looking all around. Okay, perfect. Just being careful and diligent just to be sure everything is how it should be. Okay. And if you could just tilt your head up a bit more. I'm just going to have a quick look under your jawline just to see if I can see any issues. Just okay. Just okay. Okay. Perfect. Okay. And if you could just tilt your head to the right place. Thank you. Just have a quick look. Everything seems absolutely fine. Nothing to be too concerned about. And if you could just tilt your head the other way, please. Thank you. Just having a look. Okay, perfect. Okay. Okay. Great. Everything seems absolutely fine so far. Just gonna have a quick note down just to keep your notes on file for next time you visit. Absolutely fine so far. Just okay. Great. So, the next part of the examination is using the dental mirror just to have a look inside your mouth. These dental mirrors are absolutely pivotal for our job. We can see every little corner of your mouth. We can be able to view any cavities or anything which may be something to have a bit more of a look at into, but again, I don't anticipate there being any problems today. Okay, so please, if you could just open your mouth as wide as possible. That's it. Very good. I'm just going to have a bit of a look around with the mirror just to see if I can see any problems at all. So if you can just stay as still as possible, that's it. And keep that mouth wide open. That's perfect. Okay, just getting close. Just okay. Okay, just looking up the top of your mouth. Okay, just keep it wide. Okay. Okay. Perfect. Just okay. 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 That's great. Thank you for staying so still there. That's very good of you. I'm just gonna take a few notes again. I didn't see anything to be worried about. In fact, on first view, the state of your teeth is excellent. You do really look after your teeth extremely well. Okay, let's just have a note down. Perfect all round so far. No signs of any cavities. It appears your wisdom teeth have already come through, which is good, so there's no issues there. We have a lot of patients that come through who are just starting to have their wisdom teeth pop up, and it can be quite a bit of a painful experience for some of them, so it's good that you've managed to get past that stage without having any removed. Okay, ideal. So the next stage of the examination is a very important one because plaque can be extremely difficult to remove with just a toothbrush. So we have, as dentists, these two tools here. These tools enable us just to scrape away any plaque or any debris or anything in between your teeth, which may, if kept there, may cause a cavity or may cause a stain or stuff like that. So this is a very important part of the examination. it may be slightly uncomfortable for you. I'm sure you've had this done to you before, but I like to be as in-depth doing this as possible because I do think it's extremely important to do. So again, please keep as still as possible and keep that mouth as wide open as you can. Cool. And don't forget to let me know if you find it too uncomfortable. I'll be sure to be as gentle as possible though. Okay. Are you ready? Cool. Okay. Just gonna quick obvious scrape around just your front tooth. Just get it in between. Get it in between. Let's get a bit closer, shall we? Just to get in between. In between. Just. Okay. Just. Scrape away the plaque. Spectacles of plaque. Scrape away. Very slowly. Scraping away. Scrape away, just there. Okay, just okay, is this comfortable for you so far? Yeah, I know it can be slightly uncomfortable to be fair, but you're doing extremely well. Okay. Some plaque there. Okay. Just gonna go into just your corner of your mouth where you were suffering from that toothache the other day. I'm just going to remove all the plaque I can find from that area of your mouth. I'm just going to use the little mirror just to have a little bit of a better look and see where I need to. Okay, just okay. Okay, just up there. Okay. Okay. Just relax, just relax. Just take it away. All that plaque. Okay. 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 Being very brave. Keeping very still. Good job. Very good job. Okay, just get inside into between your front teeth, just gently just get rid of that plaque, just scrape, scraping away all that plaque. Okay, perfect. So, good news is your teeth are in exceptional condition. I can tell you do really look after your teeth very well. It appears to me you don't have too much sugary or acidic drinks, do you? Or much coffee? Yeah, we get quite a few people in who drink a lot of that kind of stuff, and they get left with some little stains and tend to have, on average, more cavities and stuff like that. So keep at that and try to drink as much water as you can. Okay, take my gloves off, and this, I would recommend, as every dentist does, to floss a bit more. I'm a dentist and I don't enjoy flossing, but it's something which will be really beneficial to you. I did notice quite a bit of plaque just in between some of your teeth there, which could have been prevented by just flossing maybe on a bit more of a regular basis. Ideally, twice a day. If not, just once a day. Or like me, once every 6 months. Yeah, I should probably listen to my own advice. Okay, take these off. Okay, so let's just take down a few notes just to be sure we've got everything written down. Okay, so exam went extremely well. Patient's teeth are in immaculate condition. Immaculate condition. And my hands are extremely sweaty from wearing those latex gloves. I won't write that down actually. Okay. From results of this examination, I can tell we probably won't need you in for another examination until maybe a year from now. Our reception team can book you in for that examination if you wish. There will be the standard $20 charge though, so it's up to you whether you want to come again in a year. I would recommend it though. Okay. Before we end, I have some products which you may be interested in buying. I'm not trying to sell you stuff for the sake of selling you stuff. These dental supplies are highly recommended by myself. So it's up to you whether you want to make the purchases outside with our reception team once you leave. I would highly recommend using this fluoride mouthwash. It can really help protect the teeth against cavities and tooth decay. Recommended you have your mouthwash after a meal or after maybe a coffee or something like that. A couple times a day is ideal. I know we don't like flossing, but if you want to make a change in your life and you want to become a flosser, then I highly recommend these Oral-B satin tape floss, I don't know what you call it. I'm a dentist, I don't know what you call them. Floss string, I guess. So, yes, you can make this purchase outside with our reception team. A final thing is a new product we've had in. These are interdental brushes. These are very good for getting in between your teeth and again helping prevent cavities and tooth decay. Highly recommended. In fact, I think you should buy some now and give me the money if you want. Okay, just wait till you get outside then. Okay, sir. So thank you for coming today. Again, if you want to book in for your next examination within a year's time, then you can do that outside. It's nice seeing you today, and your teeth really are amazing. In fact, I'd say they're the best teeth I've ever seen in my whole entire career, so congratulations for that. In fact, for having such good teeth, you get a free used toothbrush, used by myself. So you can take this toothbrush if you wish. You can give it a clean. Don't want a toothbrush? Okay. See ya.